All right, so today we're talking with Lisa, and Lisa is interested in improving the youthfulness around the eyes. So one of the things that we talk about is doing an upper lid blepharoplasty or an eyelid lift. And even though there's lots of options, this is a very straightforward procedure for most patients. And in her, we want to target a few specific things. First is going to be some of this extra skin on the upper lid, okay? Now it's important to note that her brow has good elevation here. And yes, there's been some coloring to it, but the elevation is good. So we don't need to lift this anymore. She might look like Spock. That's not good, but we do want to take this extra skin away, okay? This extra fold, especially here. In addition to some of that skin, there's a little bit of fat there's a little bit of fat here, and we can reduce that and just freshen up the lids a little so we see more of the lid and have less of this overhang. There's only so much that Botox can do to lift this without creating, again, the Spock look, which we don't want. So a brow lift really isn't in her cards, because even though that brings things up, it's just too surprised. So we want to just do a very conservative blepharoplasty of this skin here and rejuvenate the outer portion of the eye. Today's procedure is going to be done under local anesthetic. So that means that she'll be awake for the procedure. Okay, great. We will do some things to make it most comfortable for her, including some eye drops that help numb the eye and some different things to make it very comfortable. That being said, most patients get this procedure done under general anesthesia because it's very hard to operate around the eye and have people be calm and still. But we're going to discuss this during the procedure, and we'll walk everybody through it so that you know how it's done and can see the results firsthand. So here we are in the operating room. We're ready to go. What we're going to do right now, however, is to make it more comfortable for her, is we're going to put some tetracaine or numbing drops in her eyes. Go ahead and do that. A couple drops. Hold on, coming your way. You not ready for that? Look up to the sky. Look up to the sky. Go ahead, here, put another one in. Okay, here we go, over here. All right, so we're gonna let that work. That's gonna numb her eyes up, and we're gonna put some corneal protectors in. Basically, they're eye shields. We use them on all our blepharoplasty patients, and it does two things. One, it protects the cornea from any potential injury, and the second thing it does is it helps black out what she can see so that it's more comfortable allowing her to keep her eyelids still so that we can do the procedure while she's awake. Look up to the sky. Okay, that has a little Lacrolube erythromycin ointment on it, so it helps keep it comfortable. So I like to measure 7 millimeters from the lid margin, okay? And 7 millimeters is a good number. I really like that, 7 millimeters. Typically falls in the crease, but today her crease is kind of high, so we're going to reset that a little bit. And then we just want to map this out. I want some eversion. This might pinch a little of her lash margin, okay? So we can get an idea of how high we can go. Try to get as much of this volume as we can so that we can lift this up and reduce this. And some of this will be fatty volume. We'll take care of that. Okay, so we've put the local anesthetic in. She has the eye shields in. We're ready to go. We'll just do a little test. Does that pinch at all? How about that?
No.
You just tell me if you feel it. So it looks like we're pretty numb, so we're going to go ahead and get started. Doing great. All right, so once we've incised the skin, I'd just like to take a little skin flap off. So we'll remove this. Then we'll take a small strip of muscle to go with, okay? Yeah, so you ready? Mm-hmm. So the skin's off, and we're just doing a little muscle orbicularis excision. Taking this little strip of orbicularis is great because we can use it for different things. We could actually use it to put under the glabella for creases that people get in the 11s or different places like that. It's a good muscle graft. We've taken the skin, we've taken this little strip of muscle, and she's got this fat pocket out here over the lateral orbital rim, and we're going to work on taking this out. And so we've added a little bit more local anesthetic to make that comfortable. We're going to de-weight the brow, take this heaviness off. We've thinned that, and that's taken a lot of the weight off of this brow. It's a tiny bit swollen because of the local anesthetic, but it's much lighter and not as heavy. It won't hood over like it did. Okay, so we're closing this first side. I like to use a Prolene suture, which is a permanent stitch, but it's very non-reactive and it slides really well. And I do a running stitch that will slide. And then we'll do a little loop pull out and close it so that I can just cut that loop and slide it out. And it heals great. There's not a lot of reactivity to the tissue. It's much better than an absorbable stitch. It's what I like. Okay, so we've closed this side. We have this loop stitch here that'll allow us to slide the suture out, which is very nice. So this glides nicely, so there's a lot of freedom there, and this will heal great, and then it just leaves barely any line.